I'd like to thank Sharon and the Rattle With Us Tea Party for inviting me to be here tonight, and I'd like to thank you for taking your valuable time for being here as well. I come to you wearing several hats, one of which is I'm not a politician and I'm not a lobbyist, and as anyone who listens to my radio show, you'll know that I'm not a diplomat. I am a grunt on the front line of healthcare delivery and have been for the past 33 years of my life. I'm an orthopedic surgeon. I practice in Ann Arbor. Also, we have an office in Canton and also in Chelsea. In addition to my work as an orthopedic surgeon, I'm a clinical researcher. But I don't focus on ways to cure people. I focus on ways to prevent people from having to come to the doctor and to the hospital. One would think that that approach would be embraced by folks in medicine, the insurance industry, and corporations around the country. In fact, I've been described as Billy the Kid, the guy who's most wanted, dead or alive, because of my approach in trying to prevent people from getting injured. The reason is because there isn't any money in prevention, and unfortunately, the way the insurance companies see it, and the HMOs, and many of my brethren in the medical industry, it really costs some money. And I could be a diplomat and tell you that there are a lot of reasons why prevention isn't supported, but the main reason is because people can't make a lot of money out of it. You see, I don't make money preventing people from getting injured. Where I make money is when people get injured and I have to take care of them. I'm not saying every disease or every injury is preventable, but what I am saying is that the vast majority of injuries and the significant disease we see around our country could well be prevented, but it's not. And the reason is because there's a huge industry making billions and billions of dollars off of folks getting sick and folks getting injured. That's why I'm not very much embraced by folks in the medical industry or the insurance industry. You'd think the insurance industry would love it, but they dislike it. And the reason is because, unfortunately, what they've told me is the higher costs go, the bigger cut of the pie they get, and the more money they make. In addition to my work in prevention, I've actually been a consultant at a number of different levels, at the state level and also at the federal level. For the past 25 years, Ronald Reagan asked me to come to Washington and work on healthcare reform back in 1988. Since then, I had an opportunity, in addition to work with the Reagan administration, with Bush 1, Bush 2, and actually even the Clinton administration, not that they ever listened. What I found out very quickly, Ronald Reagan's approach to my approach of prevention was, Dave, just help people. I don't care who you get mad. I don't care if the insurance industry gets mad. Just make people, help them. While with Bush 1, Bush 2, and Clinton, the response was, well, you can't do that, Dave. You can't focus on prevention because a lot of people that donate a lot of money from the insurance industry and the medical industry and the pharmaceutical industry don't want us to go this route. And that's why when you hear my show, I talk about the fact that when Ronald Reagan left office, our country forever changed. Because every person who's occupied that office has been owned and operated by the same syndicate, and that includes the current President of the United States. I have opposed not only Obamacare, but Clinton care. And the reason is because they both do the same thing. And unfortunately, the Bushes didn't want to do much of anything either. But the two other approaches, Clinton or Hillary care, Clinton care, and Obamacare, are focused on the most unethical and inhumane means of cutting costs. And that's the rationing of care. Many people described me back in the 90s when I opposed Hillary care as being anti-woman. When I opposed Obamacare, I was called a racist. I'm not a racist. I don't know of anyone who's ever walked in an operating room and put a knife on a skin that's a racist, because once we get through the first 2 millimeters of skin, folks, we're all pink. I'm not a racist. I'm a realist. I mentioned I've been a physician for 33 years. 33 years ago, I put my hand in the air and I took an oath, the Hippocratic Oath, the same oath that every physician has taken since 400 BC. And part of that oath is to do no harm. I believe Obamacare is harm. And the reason why I believe it's harm is because the heart and the soul and the core of Obamacare is about what I fought against the insurance industry and the ivory tower medical elite industry for 30 years. See, the heart, the core of it is to ration and deny care, the most unethical and inhumane means of cutting costs. I'm going to talk about the basics of Obamacare, and Senator Colbeck is going to talk about specifically in the state what we're facing, but also some alternatives. I believe healthcare reform in our country has become a domestic Vietnam. I don't use that term loosely. But one of the lessons that we learned out of Vietnam is if the policymakers and the decision makers don't listen to the grunts on the front line of the war, you will lose that war. And that's exactly what's happening now in our country with healthcare reform. The policymakers and the decision makers are creating programs that truly focus on ration care when many of us on the front line are saying, quit trying to manipulate healthcare need and prevent healthcare need. It's the single greatest bang for the buck. Let's make people safer and healthier. Let's make the programs more free market based, where we take the money out of the hands of the insurance industry, the HMO industry, the pharmaceutical industry, and government bureaucrats, and put it in the hands of people. This is why I am universally hated in Washington, D.C., and proud of it. I think it's important that when you talk to your friends, because it's up to you, do not rely on the mainstream media to deliver this message. The mainstream media, including Fox, is owned and operated by the same criminal syndicate that put both Bushes, Clinton, and Obama in power. And that's the criminal international banking syndicate. And if you don't believe me, go to my website at davejanda.com and download some of these interviews of whistleblowers that I've interviewed over the past 2.5 years. No, folks. You cannot rely on the media, and you cannot rely on people in Washington. The people you need to rely on are sitting in this room, because it's about educating as many people as we can. It's the ultimate in grassroots education. And my goal is to give you some points that you can drill home to your neighbors, to your family, and to your friends of why they cannot allow the most freedom-stripping piece of legislation in our country's history to be implemented, that being Obamacare. Some very basics. Obamacare is two parts. Not just the health care bill that was passed into law in March of 2010. The first part of Obamacare, which 99% of the American public does not know about, is that the first part of Obamacare was hidden in the stimulus bill. When Sarah Palin talks about rationing boards and death panels, Sarah Palin was right. But here's where she was wrong. The big rationing board was hidden in the stimulus bill and passed into law in February 2009. You see, in the stimulus bill, there were two boards created. First, the Rationing Board, which was the Federal Coordinating Council for Comparative Effectiveness Research. The second board was the Enforcement Board, the Office of the National Coordinator of Health Information Technology. The question is, how do I know that that Federal Coordinating Council for Comparative Effectiveness Research is a rationing board? Because when I reviewed the British healthcare system in the mid-90s, and why did I do that? Because Bob Dole had called me in and asked to review Hillary Care with one other individual and tell him what was right about it and what was wrong. And we found a couple good things about Hillary Care, but many bad things. And that's what was used to blow apart Hillary Care. When we looked at Hillary Care, they had this board created that focused on rationing and focused on comparative effectiveness. When we searched comparative effectiveness back in the mid-90s, we actually found the root of it was back in the British healthcare system, rationing boards. You see, comparative effectiveness, the definition, is a definition of rationing. It's the approval or rejection of a treatment or a test based on two things: the cost of the treatment, get ready, divided by the number of years the patient will benefit. Rationing. Friends of mine in Washington, when the stimulus bill was being crafted, called me. It helps to know some folks that work in the White House that aren't political appointees. He said, Dave, there's something coming down, and there's something that's going to be hidden in that stimulus bill associated with health care. When that bill was disseminated to the public, which is around about 2 or 3 o'clock in the morning, that's when Pelosi let it out, I downloaded it from the Congressional Budget Office. And after a couple hundred pages, I still was coming up empty. But after I got around to page 250, there it was. Comparative effectiveness. A board created around comparative effectiveness. You see, comparative effectiveness essentially is going to ration care because the treatment or testing approval is going to be completely based on not only the cost, but look at the bottom part of that equation. The number of years the patient will benefit from the test or the procedure. As far as the national coordinator and it being an enforcement board, it says in the stimulus bill, the national coordinator's office will, quote, guide medical decisions at the time and place of care. That is beyond scary. A bureaucrat that has no functional medical knowledge is going to have a say over who gets treated and who doesn't, and who does get treated, what type of treatment they're going to have. And they're going to base that decision on one thing, that being that formula from the Comparative Effectiveness Council. It goes on to say that this board will be responsible for monitoring treatments and ensure providers, doctors, nurses, and hospitals are following government protocols. Hospitals and providers, it goes on to say, that are not, quote, meaningful users of the new system will face penalties, and the Secretary of Health and Human Services can impose, quote, more stringent measures of meaningful use over time. Now, what does that mean? Back before the health care bill passed, I was asked to be a keynote speaker to Congress at a congressional dinner in the Capitol building in Washington, D.C. There were dozens and dozens of congressmen in that room and dozens of their staff members. And I said to them, what does this mean? Are you telling me that when Obamacare is implemented, I walk in the room, I see a patient, I decide that patient needs a treatment, but it doesn't follow your protocol. Are you saying that I'm going to get penalized for practicing high-quality care as opposed to what you're telling me to do? The congressman stood up and said, Dr. Janda, that's right. You can anticipate that your first offense of not following the government protocol, you can be fined up to $100,000. So I said, okay, well, I'm going to do what's right for the patient, so somewhere I'm going to have to win the lottery to pay off to, in order to keep working. But what happens when that second patient comes in? Because according to this, there are going to be more stringent measures. What happens the second time? Another congressman stood up and said, Dr. Janda, you could well go to jail. I started laughing. Nobody else in the room was laughing. The point is that my mom was a history teacher. And at the end of this presentation to the members of Congress, another member stood up and said, I'm going to do the Sunday morning talk shows in a couple days. If they ask me what's the one word to describe Obamacare, what do I say? And I'm thinking disastrous, malignant, devastating, disaster. And then I went to back with my mom. My mom was a history teacher. And she educated me that on many different types of systems around the world. And she said, when you have authoritarian nationalism that penalizes and punishes anyone and everyone who opposes the state, That is fascism.